Hi my dear friends, in this video we will discuss the differential diagnosis of the abdominal pain according to different abdominal regions. Now my dear friends, if you have not watched my separate video on abdominopelvic regions, then please watch this video first, then you will get 100% from this video. Okay friends, so let's begin. So these are the 9 regions. This one is epigastrium, this one is umbilical, this one is hypogastrium, this one is right hypochondrium. Why it is called hypochondrium? Because our different organs, our body, different organs are present just below the costal cartilages. That is why these are called, this one is called right hypochondrium and this one is called left hypochondrium. This one is the right lumbar region, this one is the left lumbar region, this one is right inguinal region, this one is, this ninth one is left inguinal region. So these are the 9 abdominopelvic regions. Now different body structures, as you can see in this picture, different body structures are present in different regions, and on the basis of their pain in different regions we can diagnose in which organ there is pathology. So these are the 9 regions and these are the 4 quadrants. As you can see more clearly in this picture, the different organs in different regions, and here in this picture you can see very clearly that different organs are present in different quadrants. So in the epigastrium region, this one is the epigastrium region, you will find heart, esophagus, stomach and the pancreas, and also the duodenum and the liver. So if there is any pathology in these different organs, then you will find in your patient pain in the epigastrium region. Now friends, here remember one thing, that the stomach is present in the left hypochondrium, epigastrium region, the umbilical region and the right hypochondrium. So if there is any pathology in the stomach, then you will find pain in this region, in this region, in this region and in this region also. Similar to this, the pancreas is present in this region also and this region also. So if there is any pathology in the pancreas, then you will find pain in this region and in this region also. Duodenum is also having 3 regions. You will find pain in 3 regions, this one and this one. And if there is any pathology related to the liver, then you will find pain in this region and only in this region. In the right hypochondrium and in the epigastrium region, you will find pain only in these 2 regions. Now coming to the lumbar region, in the lumbar region there are kidney, ureter and the ascending colon in the right side, and in the left side kidney, ureter and the descending colon. So if there is any pathology in the kidney, ureter and the ascending colon, then you will find pain in this region. If there is any pathology in the left side, in the kidney, ureter and the descending colon, then you will find pain in this region. Now in the umbilical region, what are the structures present? The pancreas, the stomach, the duodenum, the small intestine which part? Only the jejunum and the ileum part. And in the umbilical region there is a transverse colon. So if there is any pathology in these different organs, then you will find pain in this umbilical region. Now coming to inguinal region, in the inguinal region there are, in the right side there is cecum, appendix, ovary and the fallopian tube. So if there is any pathology in these different organs, then you will find pain in this right inguinal region. In the hypogastrium region, this one is the hypogastrium region, there are sigmoid colon, urinary bladder, uterus, prostate and the testes. The uterus is present in the female, prostate and the testes are present in the male. So if there is any pathology in these different organs, then you will find pain in this region. On the left side there is descending colon, sigmoid colon, ovary and the fallopian tube. So friends, we have talked about the different organs in different regions. Now coming to different organs in different quadrants. So heart and lungs are present in both quadrants. This one is right upper quadrant, this one is left upper quadrant, this one is right lower quadrant, and this one is left lower quadrant. So if there is any pathology in the heart and the lungs region, then because lung is there is right lung and there is left lung, so if there is pathology in the right lung, then you will find pain in this quadrant, and if there is pathology in the left lung, then you will find pain in this quadrant. But if there is any pathology in the heart, then you will find pain in both quadrant. Now friends, if there is pathology in the liver, gallbladder, biliary system and the duodenum, then you will find only pain in the right upper quadrant. And if there is pathology in the stomach, spleen and the pancreas, then you will find pain only in this quadrant. But my dear friends, here one thing is very important, that the small intestine, large intestine, uterus, fallopian tube, ovary, abdominal aorta, urinary bladder, ureter, testes, prostate, all these organs are present in the midsection there. Therefore, if there is any pathology in these organs, then pain will be felt in this region, in this quadrant as well as in this quadrant also. So if there is any type of pain in the right lower quadrant or in the left lower quadrant, then you must think there is pathology in these different organs. But the appendix is present in the right lower quadrant. So if there is any pathology in the appendix, then you will find pain only in this region. But here one thing is very important, that if there is early pathology in the appendix, then you will find pain in this umbilical region. This is very important. This is very important. And later on, the pathology, the pain will be felt at this region where it is actually situated. Now friends, everything is now very easy. So diagnosis you can make very easily, all the diagnosis. If there is pain, there is a pathology in the heart, then there is heartburn, indigestion, hiatal hernia, epigastric hernia, stomach ulcer, duodenal ulcer and the hepatitis. All these pathology will cause, all these diseases will cause pain in the epigastrium region. The functional dyspepsia, gastritis, stomach ulcer and the pancreatitis and the splenic disorders all will be present in this region. Now in the right region there is liver, gallbladder, duodenum, stomach and the biliary system. So what diseases will cause pain in this right hypochondrium? So there is gallstones, cholecystitis, stomach ulcer, duodenal ulcer and the hepatitis. So if there are these diseases, then these diseases will cause, there is pathology in these different organs, then there is pain in this region. In the lumbar region, in the right lumbar region, kidney stones also here, kidney infection also here, inflammatory bowel diseases, because large intestine is present in this region, and because of this there is inflammatory bowel diseases here also. Constipation also, because it is related to, this region is related to large intestine. Now coming to umbilical region, so if there is pain in the umbilical region, then it may be because of umbilical hernia, early appendicitis. Remember friends, this is very important. Appendix is present in the inguinal region, but if there is early pathology in the appendix, then early appendicitis will be, the pain because of the early appendicitis will be felt in the umbilical region. This is very important. Stomach ulcer, inflammatory bowel diseases and the pancreatitis. Now in the hypogastrium region, there is bladder infection, prostatitis, diverticulitis, inflammatory bowel diseases, inguinal hernia, and because of this inguinal hernia there is groin pain and there is pelvic pain because of the gynecological disorders. And what are these gynecological disorders, we will discuss later on. Now coming to the right inguinal region, so the appendicitis, later appendicitis. Early appendicitis will be felt in the umbilical region, but the later pain because of the later appendicitis will be felt in the right inguinal region. Then inflammatory bowel diseases, constipation and the pelvic pain because of the gynecological disorders. Similar to this here also. Now friends, coming to the quadrants. So if there is pain in the left upper quadrant, then you must think of gastritic ulcer, gastritis, herpes zoster infection, myocardial ischemia, pancreatitis, pneumonia because of the left lung, pulmonary embolism, splenic rupture and the distension. If there is pain in the right upper quadrant, then you must think of appendicitis retro because of the retrocecal. If the position of the appendix is retrocecal, then pain will be felt in this right upper quadrant. Biliary colic, cholangitis, cholecystitis, Fitz-Hugh-Curtis syndrome, hepatitis, hepatic abscess, hepatic congestion, herpes zoster infection, myocardial ischemia, perforated duodenal ulcer, pneumonia because of the right lung, pulmonary embolism. Now friends, if there is pain in the right lower quadrant, then you must think of aortic aneurysm because of the leaking or because of there is rupture in the aorta. Appendicitis, obviously, because appendix is present in this region. Crohn's disease, diverticulitis, ectopic pregnancy, endometriosis, epiploic appendicitis, herpes zoster, inguinal hernia, ischemic colitis, Meckel's diverticulum, Mittel's Merz disease, ovarian cyst, ovarian torsion, pelvic inflammatory diseases, psoas, abscess, regional enteritis, testicular torsion, and the urethral calculi. And this similar in this quadrant also, because all these organs are present in the pathology related to, all these pathology are related to because of the different organs are present in the middle section. So this pain will be also in this region and in this quadrant, also in this quadrant. So friends, please don't worry, we will discuss in detail about all these disorders in the medicines and the surgery subjects. Okay friends. Now friends, there are some pathology in which the pain is not felt in a specific quadrant, but in spite of it the pain is a diffuse type of pain. So what are the conditions in which there is diffuse type of pain? So this is the aortic aneurysm, aortic dissection, appendicitis, early appendicitis, bowel obstruction, diabetic gastric paresis, familial Mediterranean fever, gastroenteritis, heavy metal poisoning, hereditary angioedema, malaria, mesenteric ischemia, metabolic disorders like Addisonian crisis, the alcoholic ketoacidosis, that is aka diabetic ketoacidosis, porphyria and the uremia. Next is narcotic withdrawal, pancreatitis, perforated bowel, peritonitis because of any cause, sickle cell crisis and the volvulus. So these are the diseases, these are the pathologies in which there is diffuse type of pain. So friends, this is just the overview of the differential diagnosis according to different regions and according to different quadrants, but you will understood very well all these things when we will discuss all these disorders, all these diseases, all these pathology, when we will discuss in detail all these pathologies in pathology subject, in medicine and the surgery subjects. But here just remember all these disorders in different, all these pathologies in different regions and in different quadrants. So my dear friends, this is all about the differential diagnosis of the abdominal pain according to the different abdominal regions. Friends, if you really gained this video, then please share this video as much as possible to your needy friends. And in the last, thanks for watching this video and I wish you all the best for your bright future.